Hello everyone, welcome back to my channel. So in this we are going to see AIMS Norcet 6 mains key paper. So questions are: anatomical site used in case of lumbar puncture. The answer is iliac crest. Intralipid, what is the route of administration? It is central line. What type of diet is given in manic patient? Finger food. In psychiatric unit, patient transfers the emotion towards nurse like as third person. This indicates transference. Surgical instrument sensitive to heat and moist. Which method is used for sterilization? Ethylene oxide. Adrenaline injection should be diluted with 9 ml NS and 1 ml adrenaline. Patient addiction free from opioids, and the patient in order to prevent from re-addiction of opioids, what should be given is disulfiram. Vitamin A injection first dose timing is 9 months. To reduce risk of respiratory depression, which position to be given? This is a common question we know. 45 degrees elevation. What is the test used for cystic fibrosis? It is sweat chloride test. Then in ventilator alarm, there is low tidal volume. What is the priority? Oxygen administration by non-rebreather mask. pH 7.39, PCO2 54 mmHg and HCO3 is 30 mmHg. So it is respiratory acidosis fully compensated. So in ECG ventricular fibrillation was given. So what we are supposed to do is give CPR and defibrillation. When teaching a patient who has a diagnosis of schizophrenia about successful independent living in the community, so the nurse should encourage what the patient should do is establish a structured daily routine. Psychiatric patient watching TV, he said that TV anchor is saying some secrets to him. So what type of delusion it is? It is ideas of reference. What is the best way to administer potassium except IV bolus? A chronic alcoholic patient lasts from 10 years. Then due to thiamine deficiency, what is the complication? It is peripheral neuropathy and ataxia. Within how much hours IV tubing should we change with the blood product or fat embolism? That is within 24 hours. Holiday Sagar method calculation for 20 kg weight child. It is 1500 ml. So this image was given. So it is waxy flexibility. Preferred route of dextrose 50%. It is central line. Restraint which is used for cleft lip surgery. It is elbow restraint. Why morphine is stored in safe place? In order to prevent from theft and misuse. Adult male suction catheter size 14 to 18. Atropine dose during bradycardia according to AHA 0.5 mg. Contraindication of drug in pregnant woman who is having cardiac problem. Warfarin. Why syringe is heparinized during ABG sampling? So in order to prevent clot formation. A pregnant woman on heparin therapy had toxicity. Which medicine is given to prevent toxicity? So a simple question is antidote of heparin, that is protamine sulfate. Which of the following medication is given IV bolus followed by NS? Amiodarone. Which of the following are correct about calcium gluconate administration except rapid IV bolus? Which of the following are correct regarding before vancomycin administration except Ray's syndrome? To perform Allen test before ABG sampling, which of the following is correct about ulnar patency? After 3 to 5 seconds, it should come back to pink color palm. After insertion of central line, how to confirm the placement priority? That is chest X-ray. A child with TB taking anti-tubercular drugs and the mother is concerned about red color urine. The nurse's response to this is reassure mother that this is expected. Child with HIV had a risk for TB. Which prophylaxis ATT to be given? Isoniazid. A type of special syringe that is used to draw ABG sample is heparinized syringe. A one-day neonate is drooling. A nurse tries to put NG tube but fails. What condition can be predicted? tracheoesophageal fistula. After exploratory cholecystectomy, a patient is in post-anesthesia care unit. Which symptom is best in evaluating severe hypovolemia, that is hypotension? A patient to be infused 2 liters of fluid within 8 hours. How much ml of fluid to be infused per hour? It is 250 ml per hour. So for drug calculations and ABG interpretations, I'll be uploading the next videos. Please subscribe my channel. Flat line electrocardiography protocol. So what to expect? Continue CPR. What is Behling suture on obstetrical hemorrhage? It is to prevent postpartum hemorrhage. During blood transfusion, a patient suddenly developed dyspnea. What is the immediate action? Stop the transfusion. Most adverse effect of MAO inhibitors in which patient showing hypothermia, agitated, confusion and autonomic dysfunction. So severe it is hypertensive crisis. Child is admitted with fever, weighs about 15 kg and have a prescription of PCM of 20 mg per kg body weight. Available dose is 250 mg per 5 ml. So the answer is 6 ml. In which phase preparation of termination phase initiated? It is orientation. What is the nurse's immediate priority action when the central line dressing becomes soiled? Change the dressing. 15 months old child ideal body temperature site, axilla, which includes in surgical safety checklist. Patient identity. A nurse educated to mother about IPV, which statement are true about IPV? It is IPV are more potent than OPV. Emergency contraceptive of choice, levonorgestrel. Patient admitted with headache, sensitive to smell, light and sound. Which medicine order nurse confirms before administration? Morphine. 7-year-old child with shock brought unconscious to emergency. What is the best method to estimate weight? Broslow tape. So radiant warmer was given. In this instrument, what is the mode used just prior to preterm delivery? It is servo mode. During expulsion of placenta, placental surface is shiny. This indicates that surface of the placenta is visible from which side? It is Schultz method and fetal surface. So these are the AIMS mains questions which were asked in the exam. And so many are preparing for the upcoming ESI exam. So you can just watch other videos. ESI important questions, what is the syllabus and what are the topics to focus. So please don't forget to subscribe and like this video.